if you have some topics or things that you want us to cover. I'm going to slide that out of the way and I'll come back to that to see what all you tell me you want to learn about today. I think it's fun to go and learn new things, but I'll usually always have one or two things that I'm hoping to walk away with or a question that I might have that I want answered. And so I want to do that for y'all today as well. So, this is Your Health After 40, and I am an assistant professor at the Capstone College of Nursing here at UA. I am a registered nurse. I am a certified health and life coach, a former well-being ambassador for the Honors College where I taught for 10 years, and your wellness class educator. And you can reach me at abby.horton at ua.edu. I love to connect with y'all. I am a native Tuscaloosan, and Tuscaloosa UA is home for me, and so I love getting to know you. And if you have questions or comments or feedback, please feel free to reach out at any time. We'll also have some time at the end for some questions and answers, but I know sometimes things come up for y'all after the class is over, or maybe you just want a one-to-one connection or a question answered, and that's great too. So, a couple of the things that we want to do today. We want to identify some common health concerns that people over 40 or approaching 40 might have, discuss the importance of health screenings that you would want to be mindful of moving forward, discuss some useful strategies for effective weight loss and health management, and then identify how to stay fit over the age of 40. But most of what I'm covering today, quite honestly, applies to any age group. It's just that the health screenings that I recommend are going to be more age specific as we start to look at the kind of part two of our lives. So I am not 40 yet, but I am very, very close. I tell people I am closer than not. And so these are the things that I'm also doing personally for my health and wellness. So sometimes health and wellness feels like it's a part time or even full time job. And if y'all feel that way, I'm in the boat with you. So, some common health concerns that we can have. Chronic pain is a big one. So, things like arthritis, back pain, tendonitis. We can even have generalized pain. Joint health becomes very, very important, more so because we start to feel the effects of poor joint health. Osteoporosis is a concern, not just for men but and women, but we start to have a lot of age-related bone concerns. We usually think of that being a female concern, but certainly that can impact any of us, all of us. And so we'll talk about that. Stress becomes, I think, a challenge for everyone. Even looking at adolescents today, they are more stressed than ever. And so stress is not something that just 40-year-old plus concerns. But it becomes more of a concern because you have more and more responsibility usually. And, the wear and tear of everyday stress and health concerns can add up. And that cumulative effect really starts to play a role. So stress can be acute or chronic or both. You can have both types of stress. Depression and anxiety tend to increase in midlife and tends to get better once you get past the decades of the 40s on into the 50s and 60s. Today in America, at least, 50 and 60-year-olds, particularly those who have retired, start to report an increase in happiness and life satisfaction. And so that's very telling. So we're going to talk about how we can start to incorporate um, fulfillment and satisfaction and joy and those kinds of things into our everyday life. And we don't have to wait until we're 50 or 60 or retired to feel those. I don't know about you, but I want to feel those things now. I want to feel joy and satisfaction and fulfillment now. Heart health, of course, is always a concern. This is becoming more and more of an issue even earlier, along with things like cancer. And so we'll talk about that as well. Blood pressure, cholesterol, triglycerides, all of that goes hand in hand. Our changes in our resting heart rate can start to impact our overall health and our feelings of fatigue, how much energy we have. So, heart rate variability is something that we pay more attention to. Inflammation, communicable diseases, blood glucose or your blood sugar, those can all impact your metabolic health. And so that's important if you have heart history of, some heart challenges, if you have blood pressure issues, cholesterol issues, and you have blood sugar issues, those are things that we consider to be metabolic syndrome, and that is on the rise in the US in the adult population. Of course, we also want to think about our body mass index. Please know that in my personal opinion, that body mass index is just one of about 6 indicators of overall health and wellness, especially when it comes to your weight. Uh, for many people, they think that BMI is the gold standard. I personally do not. I just think that it's one piece of data. There's a lot that can influence your BMI, and that can be your bone structure, how your body is built, your body composition. It could be your muscle mass. And so if you have a lot of muscle mass, your BMI is going to be higher because you tend to have more muscle. And so there are a lot of indicators that aren't represented very clearly with BMI. So if you are concerned about your BMI, it's always important to be mindful of that, but it's not the end all be all, at least not in my opinion. Skin cancer and other skin issues can be challenging. We do start to see an increase in age-related skin changes and skin cancers, and so having annual screenings or as your risk factors indicate can be really important, particularly to see a dermatologist and have a full body skin check once a year. But looking at your skin every month is also an important thing. For me, I have had precancer moles and precancer areas of my skin removed over the years. And I usually caught those myself. They weren't caught at a clinical appointment, at a health appointment. They were caught because I noticed a change. And so that's a really important thing to consider. Changes in hearing can actually start in midlife at age 40 or so, but of course, it can change at any point. And then changes in your visual acuity. So, eye strain and blue light exposure from all of our devices and things can really impact our vision and can worsen our visual acuity. Hormonal changes is what we tend to think about. We tend to think about menopause for women, and now we're hearing more about low T or low testosterone for men. Of course, we're talking in the binary of men and women, but we know that there are other representations. And so just know that when we're saying male and female, that's how the literature reports it. And it's because we're thinking about the dominance of whether it's testosterone or estrogen or progesterone. And so, please hear me say that. Sexual health, of course, is always important throughout the lifespan, but the misperception is that sexual health or sexuality becomes less of an issue as you age. And we know that that is not true. And so, sexual health is still very important to most people. And then lifestyle changes and just overall mental health. So, depression, anxiety, and stress. How do we manage that well? And how does resilience play a role? So, there are probably more health concerns, but these are the ones that you will often see or hear about most often. And so I love Brene Brown. If any of y'all are familiar with her work, please feel free to pop that in the chat. I'm going to pull up my chat so that I can see y'all, but I'll have to turn so I can see what you guys say. But any of y'all fans are familiar with Dr. Brene Brown? I would love to. Yeah, Jess loves Brene Brown. I am a fan of her work. Absolutely. So she's a social worker in Texas. When you grow up, you want to be her. I do too. I want to be her friend, but I feel like if we knew each other, I feel like if she knew who I was, I feel like we would be really good friends. So I love her work, and she talks about midlife. Oftentimes we think of midlife as being a midlife crisis. Those go hand in hand, but it doesn't have to be. But she says that it's important to pause and reflect and reset at midlife. I think that's important all the time, but her quote here is, "It seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open everything back up to heal the hurt." And so midlife is not a crisis, midlife is an unraveling. And the reason that I say that is, and include that here, is because oftentimes when we say, I'm approaching my 40th birthday or I'm past 40, sometimes we can feel like we're in chapter two or part two of our lives, or we can feel like that, we're getting, close to milestones that maybe we're not happy about. And I love her take on midlife as it's an unraveling. It's peeling back the layers of what we thought maybe was important to us in our 20s and 30s, and really deciding more proactively and more intentionally how we want to live our life moving forward. So I think we can really embrace that and embrace the health challenges maybe that we start to see with that kind of attitude. And so I hope that that's impactful for any of you who may be feeling like midlife is approaching, or maybe it's arrived and you're not exactly happy with where you are. That positive reframe or neutral reframe of, what is this season, or if we're going to borrow from Taylor Swift, what does this era of my life look like? And I think that that can be an impactful way to approach midlife and even health concerns. So a couple of you said that you've never heard of her. And so I would really recommend her work. She's a social worker. She's based out of, I believe, Houston, Texas. She's really well known and popular in the mental health realm and in healthcare because of her impactful TED Talk that she delivered over a decade ago on the power of vulnerability. She's written a ton of books. She's got a podcast. She's got tons of free resources online. And she's someone that's been really impactful to me in my personal development and in my health and wellness goals. And so really recommend her. So, going off of this, looking at screening and prevention, I think this is really the key to healthy living. So, what is that old adage? An ounce of prevention is worth a pound of cure. So, I think that's true. If we can prevent something from happening, or we can prevent something from worsening, then we're going to be much better off than if we're trying to do a treatment or do a cure for a health concern that pops up. And so, some things that you can do in your well-being screenings that Miranda mentioned, we do some heart health screenings. So, we look at your cholesterol, we take your blood pressure, we measure your triglycerides and your blood glucose. And we like to do that fasting, so not having anything to really eat or drink beyond water or maybe black coffee with nothing else added. And that's a fasting blood glucose or blood draw. That's best, but we also can do it if you have eaten, and we'll just look at the numbers differently. It'll change the range of your numbers. But just with a simple, one like little blood glucose draw, a little finger stick, we can look at all of those numbers. And so we can look at your cholesterol, your triglycerides, we can look at your blood glucose, and we can calculate your BMI with doing some biometrics. So we take your height, your weight, your waist circumference, and we calculate your BMI in that way. And then we look at your overall health risk and activity levels. We talk to you about your goals and what goals you might have. We have a few categories. Of course, maybe this prompts you to look at other goals as well. And we talk to you about your risk factors and your overall health. And I think it can be really helpful to you to know those numbers. We always say in health and wellness, know your numbers, meaning know what you weigh, know how tall you are, know what your waist circumference is, know what your blood sugar is running after you eat a meal, or in the morning before you've had a meal, so that you can make changes if they're needed, and if not, so that the changes that you are making or the lifestyle that you have adopted is working well for you. So data, knowing your numbers is just knowledge, and knowledge is power, and that gives you a lot of control and autonomy over your health, and that's what we want to do. Health and wellness is all about empowering you to be in the driver's seat of your health. So some annual physical exam recommendations that we have. So beyond your well-being and health screening, which is great because you get to come and see me, you get to come and see our wonderful nursing students and our health and wellness team, Miranda, Sierra, and Carolyn. But you also get a free t-shirt, you can get a free apple, you get to know all these data numbers for free, and then you also get the incentive of having a $50 Visa gift card. And so I went through my health screening yesterday with the students. We had our last one of the spring semester, like Miranda mentioned. And it was nice for me to get to compare my numbers this year from my numbers last year. And so knowledge is power in that way. But we also recommend that you still have an annual physical exam with your healthcare provider. And so, have that screen done. Go and see your nurse practitioner or your family doctor, and they're going to look at your medical issues. They're going to assess your risk for future medical issues, look at your family history, look at your own personal medical history. They can encourage you with a healthy lifestyle. So, come with your questions when you meet with your healthcare provider. That's so important. And then they can update any immunizations. And having an annual visit really helps you build a relationship with your healthcare provider. And I can't emphasize that enough. When we have that good relationship and good rapport, when you do have challenges and you are sick, then they know your baseline, not just your mental and physical baseline, but they know about your family. They know about the challenges, the stressors that you may be encountering, and they can really, hopefully, ideally, tailor what they tell you to do to your particular situation. And that's going to be the most impactful thing for managing your health is not just saying that all women who are 38 years old, which I am, need to do X, Y, and Z, but saying, Abby is 38. She works at the university. She has 5 school-age children. She, has this caregiver role in her family. She works this number of hours. She's had these health concerns over the years. What's best for me as a healthcare provider to tell her to do in terms of next steps for managing her health? That's really tailored, customized patient education or teaching, and that's what we want to get there for everyone. And so having that kind of relationship by seeing your practitioner on a regular basis ideally is going to let them have that information for you so that they can tell you, okay, this is what your lab work looks like. This is what it looked like last year. How's your stress? I know that you're doing X, Y, and Z. Like, how's that going? I know that sometimes we can feel really rushed when we're in healthcare appointments like that, but coming prepared, coming ready with your questions or your concerns can help facilitate that conversation. And then if you feel like you're not getting enough time with that clinician, you can have that conversation as well. So schedule your annual physical exams, make sure that you're getting lab work done. Your dental exam and cleaning is usually recommended every 6 months or twice a year. Your health screenings can include hearing screens and visual screens. So, this is said to be every 1 to 3 years based on your own health risk, but hearing screens is usually every 10 years until age 50, and then after that, every 3 years because you can have age related hearing changes. Comprehensive eye exam, meaning that you're seeing an ophthalmologist, not just an optometrist for your eye visual acuity for like glasses or things like that, but a comprehensive exam with an ophthalmologist where they dilate your pupils and are looking at those blood vessels is very, very important, particularly if you have a history of eye issues like glaucoma or high ocular pressure or anything related to your cardiovascular health. So high blood pressure, heart disease, history of stroke. Those are going to be important because those vessels are going to also be impacted by those conditions. So I think that that needs to be done annually personally, but your recommendations are probably going to say every 1 to 3 years or as needed. Blood pressure screening, I think it's important to do it annually, but honestly, if you're having things like fatigue, if you know that you're stressed a lot, if you're just feeling extra tired, or if you're particularly having headaches that are unexplained, get your blood pressure readings done. We have 2 kiosks here on campus, one at the student center near the Starbucks in the stairwell, and then one on the HR campus in the HR building. And those are going to be great. Obviously, you can always use the ones that are in the grocery stores and pharmacy. I just recommend that you use the same one. You could even get one at home if you do have high blood pressure, and that's a great resource to have where you can check it at multiple points throughout the day and then multiple times throughout the week because your blood pressure might look beautiful when you're at home in your pajamas at night, but your blood pressure might be elevated when you're at work and you're kind of managing a lot of stressors or activities. And so knowing those things can be really helpful. Your cholesterol screening, it's so important to know your total cholesterol, but it's even more important to know the breakdown of your cholesterol. So, not just that your cholesterol is less than 200, which is ideal, but we want to know your triglycerides, your HDL, and your LDL because you could be over 200, which is going to put you at a risk for cardiovascular issues, but it could be over 200 because your HDL, which we call your healthy, um, cholesterol is elevated. It's above 60, which is great, but then that can skew your total cholesterol. And so if you get a total cholesterol and nothing else, always ask that clinician, what the breakdown of your triglycerides, your HDL, and your LDL are, because you may be okay. You actually may be doing great. And so you wouldn't necessarily want to lower that. If your LDL and triglycerides are good and your HDL is great, then you may be at, a 230 cholesterol overall, and you may be great. You just may have an HDL that's higher than normal, and that's good because that's a protective factor. If you want to learn more about that, we have a cardiovascular class on the wellness.ua.edu website. You can go to archived classes, and I have a talk there that we usually teach every February for Heart Health Month, and it goes into more detail. And Miranda is popping in all of these links. I'm putting her to work today. Sorry, Miranda. And then also having a diabetes screening, that's important to do annually. They'll look at hopefully your A1C to see what is your blood sugar tracking over the last 90 days to see, okay, yeah, we all might have a spike in blood sugar if we go and get a coffee with extra sugar or we go and get a milkshake. But what does that trend look like over 90 days? And that gives you a really good picture. Okay, the next two things are going to vary a lot, but a baseline EKG, looking at your heart health, looking at a basic baseline chest x-ray can be really impactful. And annually is recommended once you get to be about 40 to 50 years old, but that's going to vary widely between your healthcare providers. At our doctor's office, we at age 40 and above start to get an annual chest x-ray. So I'm not there yet, but my husband is older and he gets one. And with his annual chest x-ray a couple of weeks ago, an abnormality was found. And it was something that is going to be really life-changing for him to be able to manage this new finding on his chest x-ray related to his heart health that would not have been caught otherwise until he had an event. And so I can't stress enough how important it is to know your baseline numbers, to know your baseline imaging, because you really can hopefully prevent some worsening of health events and maybe even prevent them altogether. And then checking your thyroid health, that is going to look like having comprehensive lab work done with a complete thyroid panel. And you can just ask your provider. I don't expect you to know all those numbers because there's a ton of numbers you would need to know for your thyroid health. But also, I really think that your clinician needs to be doing what we call palpation, just touching your thyroid. And there's a technique, it's very difficult for me to show you because you have to do it standing to the side and behind the person, but it's where you put both of your hands around their thyroid and taking turns, you press one side and then the other while you have the person swallow. And that is helping you feel on either side of that trachea on your throat. It's letting you feel if there's an enlargement or if there's a nodule or a cyst. My husband's endocrinologist actually did this years ago. And just by palpating his thyroid, which is typically not done by most clinicians, in my experience, I don't see that being done frequently, felt a nodule, what was believed to be a nodule on his thyroid. And after doing a biopsy, it was determined that it was actually cancerous. And so he had thyroid cancer and had a total thyroidectomy. And again, it was just an annual physical exam by the endocrinologist that he happened to find that had not shown up in his blood work and had not shown up on any other imaging or scans. But by laying hands and physically feeling, something we don't do enough anymore, I think, was really, really impactful and was a game changer. It saved my husband's life. And so please know that these are things that you can ask for and advocate for if your clinician is not doing it and you have a risk factor or you have a concern. Sometimes the blood work does not show these things early on, and you can catch it just by doing some of these screens. Other recommendations, obviously, immunizations are important. They're going to be very individualized and personalized to you. Everyone has a different, opinion about immunizations and comfort level. And so get the ones that you feel comfortable with. If you're concerned about risk factors, if you're concerned about adverse reactions, talk to your provider about that. Look at the information sheets that they give you and make an informed decision for yourself. But flu is recommended annually. Tetanus booster as recommended. Of course, if you have something that sticks you, or you have a scrape or something like that, where you have a wound and a puncture, it's usually recommended that you get a tetanus booster. The pneumococcal vaccine is usually going to be more into your 50s and 60s, or if you have risk factors to prevent that pneumonia, and then hepatitis as recommended. Of course, that's going to vary greatly because healthcare workers are going to be recommended to have those boosters and titers to see how much immunization, how much immunity you still have on board. So that's going to vary. And then colorectal cancer is right now the number two cancer, colon and colorectal. Number two cancer, I don't know worldwide, but in the US, it's number two. And so, age 50 and above, unless you have a high risk, you're going to be recommended to have this screening. And that could be something like having a stool sample that you do at home or in office, or it could be in a colonoscopy. And that's usually recommended every 10 years. And then, after you've had one, they usually give you a personalized schedule for when you should have another colonoscopy. You can do something like a fecal occult blood test or fecal immunochemical test. And that is usually done annually once you get into your 50s. Again, that's looking at your blood in your stool and things like that, which can be an indicator of colon cancer. But this is on the rise, and it's on the rise for young people, men and women. It's typically something you think of as being mostly in the male population over 50, but it is on the rise in young people, men and women. So kind of have that front of mind when you're talking to your healthcare provider, particularly if that's something that um, is a challenge in your family. Some other things, mammography or thermography. This can be a little bit controversial. Mammography is considered the standard of care for women 50 plus, 50 to 74 years old, to look at people with average risk factors for breast cancer to get a mammogram every 2 to 3 years. And then women 40 to 49 is usually considered higher risk. These have changed recently because there are so many women in their 20s and 30s who are developing breast cancer. So if you don't do anything else, and this is for any person because we all have some estrogen on board, and people with testosterone can have breast cancer. And so it's important that you palpate breast tissue all the way out to your axilla or your underarm because you can have those lymph nodes be involved in that breast area. So I don't know that you can see on me, but you want to do a good exam with yourself every month. And typically for women, you would want to do this after your menstrual cycle where your breast tissue is not so tender, and you would want to do a circular motion where you're not lifting your fingers off the breast, but that you're doing a circular motion from your nipple out to that breast tissue all the way out to your underarm, not lifting the fingers off of your skin because you might miss something. So having continual contact, and you use the two finger pads of your first two fingers to do what we call palpation. You also can do, in addition to the circular motion, a lawnmower motion where you're going up and down in that fashion across the breast tissue all the way out to the underarm, all the way to the center of your chest to be able to make sure that you're covering all of that tissue and that you don't feel anything. If you feel a lump, a bump, a mass, tenderness, or something like that, it could be a lymph node. You have lymph nodes all throughout that outer rim of that breast tissue. And so it may not be that there is a true concern, but it's always helpful to get that checked out. For me in my early 30s, that's where you start to have some breast changes for women due to hormones. I developed some tenderness, and when I was doing my monthly palpation, I felt a mass there that ended up being an enlarged lymph node. And it was monitored for 3 years, and I had ultrasounds regularly, and eventually that nodule went away. But that was something that, had it continued to enlarge or progress, would have been something that needed to be biopsied to make sure that it wasn't cancer or cancer forming. And so there's a lot that can kind of go into that. So for anyone has questions, please feel free to reach out. There's a lot that we could go into that, but looking at that every month is very important. Very similar to men doing testicular exams every month. I tell people if they don't have a menstrual cycle to just pick your birthday and do it on your birthday. So I was born February 12th. So the 12th of every month, I can do my self breast exam because I no longer have a menstrual cycle. I had a hysterectomy several years ago. And so I don't have that cycle. So I just pick that random date because it helps me remember. That works well for men as well. Prostate exams are really important. You can usually schedule these with your urologist. Some healthcare providers do these, but most of the time it's a urologist. And those risk factors and those age requirements are listed there. So most men can wait till 50, but some men need to do an exam at 40 or 45 or as directed by your provider. And then nicotine, vaping, tobacco products, the sooner that you can quit using those, the better for your overall health. It's not just the nicotine, it's also the caffeine in some of these products, and it's all of the additional things that you're inhaling with all of those chemicals. And so you can have on average 2 to 4,000 chemicals that you're inhaling when you're using these kinds of products. And then, of course, secondary exposure to the people around you while you're using the products is also something that's important to be mindful of, because your lung health and just your overall detox, those things are really difficult on your lungs, your kidney, and your liver, because that's where all of that's being filtered through. Making fiber your friend is really helpful for gut health and for decreasing your colon risk. And then any muscle that you can build is going to help work toward good bone health. So building muscle is going to be, in my opinion, more important than adding milk. We always think about drink a glass of milk for your bone health, but really building muscle by weightlifting and strength training, that's going to be more impactful for the long term by being really protective of your bones and your bone health. And so that's helpful for you to think about. Also, it's really important that when you're looking at mineral and vitamin and nutrient deficiencies, to try to eat those nutrients, minerals, things like that, electrolytes. Try to eat that, consume that in your diet through nutrition versus trying to supplement, and only supplement when you get those numbers saying that what you're doing in nutrition is not doing what it needs to in your body. Sometimes, we're having an absorption issue. So we always used to say in the early 90s, we would say, you are what you eat. And what I say, and a lot of people are saying now, is you are what you absorb. And so you can eat really healthy foods, but if you're not absorbing that nutrient, then or those calories and things, then you're not having good health outcomes. So you are what you eat and absorb from what you eat. So other screenings, the annual clinical breast exam, the monthly self breast exam. So every year, usually for women, your OBGYN will do the clinical breast exam. Some healthcare providers will do it, but usually it's your OBGYN. You'll do that self breast exam monthly yourself, and then the mammogram as needed. Pelvic exam is really helpful. Usually, again, that's going to be a gynecological exam with your pap smear. And that's typically going to be recommended every 1 to 3 years if you've had clear pap smears before, and usually those start at age 21. At a certain point during menopause, there are new recommendations that you can stop the pap smear test. I still am a fan of continuing on with those, just because you never know, and it's better to test than to guess. And so that's another thing I say a lot. I'm sure I've heard that somewhere from someone else, but test, don't guess. And so you may be recommended at some point in menopause that you don't have to do that any longer. And you can make an informed decision with your provider on that. And then bone density testing, usually that's going to be recommended for females. Sometimes men are recommended, but again, a lot of things in healthcare are very gendered, and usually it's going to be women in their 50s and 60s. Sometimes people will say 65 or above, because that's when you really start to see the effects of osteoporosis. But we want to be preventative, and so we want to do things early, catch things early, and work on them early. And then for men over 40, that annual testicular exam, again, healthcare providers might do this. A urologist certainly will do it, but you have to be engaged with a urology consult. And typically, unless you're having another issue, those folks aren't brought in until you're having kidney stones, or you're having some type of urinary incontinence or something like that. And so it may be your healthcare provider. And then you can do the monthly testicular exam yourself. And then prostate screening is going to be something like doing a PCA, so your prostate specific antigen, which is a blood test, or an actual manual exam that, again, usually is done by a urologist or a nurse practitioner in a urology office. Y'all, this is a lot of information. Tell me if this is too overwhelming, or is this new information? Y'all talk to me in the chat. Past 40, the chest rate, wait, chest X-ray is not something you've had mentioned before. Is this something we should specifically ask for? Stephanie, I don't think that it's completely necessary for every person, but I think if you have concerns, if you have an interest, um, certainly if you've had COVID before, if you have a lot of asthma and allergies and things like that, it's not a bad idea to ask, and they can walk through the different options for you if they think that you're at risk based on your personalized health history. But I always say to ask and have the conversation and let them let you know what they think their medical opinion is based on your individualized health concerns. But yeah, at some point I'm gonna go and get a chest x-ray the next few years. Um, but I'm thankful that my doctor's office mandates that for patients once they get to a certain age. So, yeah, I'm glad that helped. Shingles shot, yes, I am going to recommend that. That's going to be in the resources a little bit later. I didn't mention it in the first part of these slides, but yes, we'll talk about shingles. Good job. That's coming. Cancer screenings, again, breast in 40 plus. So that has lowered down from 50 to 40. Cervical cancer is usually 21 to 65 or 21 to 74. You're going to see a lot of variation on that one, and that's doing that pap smear test. Colorectal cancer, again, 50, the prostate, 45. Lung cancer is usually pretty prevalent in the US. Again, I think there's a lot of factors, and you can have lung cancer without having a history of using, products like vape and things like that. But I think lung cancer and just lung health in general, particularly with COVID, but also COVID plus the advent of so many people using vape instead of cigarettes and other products, I think we're going to see lung cancer and lung health be a bigger issue moving forward than maybe we think of it now. So these were just some other screenings based, again, very gendered, but here for your review. And then I've included some healthy habits that I think it's really important for you to start to develop by 40, but are important at any point in life. So, beginning preventative health screens, obviously, having a positive attitude. So, going back to the Brene Brown quote, really embracing where you are in life. It's important. And I think it's important to have people who are in a similar um, age and stage of life as you. I think it's important to have people who are further ahead on the journey. I think it's important to, have people who are younger than you and can kind of remind you of what it's like to be really enthusiastic in your 20s and 30s and kind of remember that phase of life. But it's also important to have peers. Peer support is hands down, I think that community and that support that you get from people who are kind of same alike, right? The people who are on the journey with you at that same stage is really, really helpful. So I've listed a few things here that I think are helpful. Sleep is foundational to health and wellness. It's just it's irreplaceable. Sleep is something that I'm personally really having to work on a lot. Miranda follows me on Instagram, and she reached out. We text and we send things back and forth on Instagram. And I said, well, as you can tell in my Instagram story, sleep is really important for me right now. And so that's something that I'm really working on because unfortunately, you can do all of the quote unquote right things and sleep can still be difficult. You can't make yourself fall asleep. You can't ensure that once you do go asleep, that it's quality sleep. And so sleep is foundational, but I think it's a really hard one to control sometimes. And so it just feels kind of elusive, good sleep for many, many people. And I think that's true for most adults in the US. And probably it has to do with our lifestyle, our stress, our blue light exposure from all of these devices. We're really living differently than most other people in history because we're indoors so much. Fluorescent lighting impacts it. I mean, there's just too many factors to name here. But sleep is very, very foundational. And so if you're struggling with that, I recommend you getting some support. I'm getting support for my sleep just because I know a lot, but it's helpful to have someone else give you an objective opinion and feedback on what you're doing and where you can go next steps wise. And that's true of every aspect of sleep, of health, of wellness. Exercising is so important. I'm in physical therapy right now because I had surgery last year. Many of you, if you've been in my classes, I had a tumor that was removed from my adrenal gland and liver. And so I'm in pelvic floor therapy, in physical therapy. And what I told my physical therapist last week is that I feel like I'm doing a lot of exercising and physical therapy exercises and stretches at night to make up for the things I'm not doing well during the day. And so it's because I'm sitting in my office a lot. And we say in nursing it's feast or it's famine, meaning like we're run, 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 go, 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 or everything's kind of stagnant. And that's really how my work life is. I'm either go, 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 like I was in health assessment and doing our well-being screenings yesterday, supervising students, and I'm on my feet and am running all day, 8 hours nonstop. Or it's a day like today where I'm in back-to-back office hours and meetings and I'm sitting. And so it's feast or famine. And then when I get home at night, I'm really tired. And I bet from having talked to a lot of people about this, I bet that's probably true for many of you. And so trying to make up for our lack of movement during the day at night, it's going to be really difficult. So trying to set like an alarm or something that will remind you to get up every hour and do some walking, go to the restroom, visit a coworker, get some water, do something, get outside on a day that it's pretty. And then also do traditional exercise. That's going to be more helpful than just trying to exercise in a really intense 1 hour workout and then not doing that the rest of the day, the week. Eating more healthy foods. We have a whole class on the wellness basics that would be really good complement to this class that you can check out on the archived webinars. Drinking more water, I think, is the best thing to start with because it's more in your control. But making sure that you're adding electrolytes in so that you're actually absorbing the water you're drinking. So filtered electrolyte enhanced water is great. Financial health, spiritual health. There's so many aspects of health, 9 to 11 aspects of health and wellness. And those are called domains of dimensions or of wellness. And so more than I can list here and talk about, but I think that's important. Maintaining a healthy sexual life is also important. I mention that here because it's usually not talked about and it's usually an uncomfortable topic. It's one of those top 3 things that we're really taught from a young age not to discuss, along with finances. That's one of the top 3 as well. And so I included those here because I think it's important that we mention that that's still a need. That's not, having a good sexual health life is not a luxury or, something that is optional. It's really a part of our basic needs. If you look at Maslow's hierarchy of needs, it's on there pretty high. So that's important. Confronting vices. Again, I use the language from this article. I don't like to use the word vices because, I think that's more of a negative approach to it. But look at the habits that aren't serving you well. So the things that you want to change that really aren't helpful to you and aren't healthy for you, look at how you can start to make some changes. As humans, we like to add things in, we don't like to subtract, right? So we like to add stuff, we don't like to take stuff away. And so the more good stuff that you can add into your life, the more that it's going to crowd out the stuff that's not as good for you. And so I always like to add versus subtract. Subtraction usually takes care of itself. On the back end of things. And then meditation, taking breaks, those are all really helpful things. Hormonal changes in women. Again, menopause is a huge part of this. So you can be premenopause, meaning you don't have any symptoms. Peri, which means around, so around the time of menopause. You can be in menopause, and then you can be postmenopause. And so usually a no menstrual cycle for 1 year is going to result in a diagnosis of menopause. And that's typically happening between age 45 and 55 for women in the US. That is very, very low and very early to have happen. If you compare us to similar countries across the globe, we on average start our menopause about 10 years before everyone else. And I think, again, it's lifestyle, it's stress, it's hormones, it's additives and chemicals in our food, it's toxic exposure. And we tend to have more symptoms in the US with menopause than people in similar countries with better lifestyle, better healthy environments. And so that's something to think about. Menopause does not have to mean that you have all of these symptoms. So hot flashes, vaginal dryness, mood swings, decreased libido, decreased concentration, brain fog is a really common one, fatigue, even insomnia, hair loss, weight gain is something that you hear a lot about, and something that women tend to mention before they mention anything else. And then metabolic syndrome, so increased risk of some of these other cardiovascular issues, is kind of front of mind for women. And then for men, testosterone levels tend to start to drop around age 40, but even in the 30s, it can happen. And then they can have things like decreased libido, hair loss, fatigue, mood changes, loss of muscle mass, increased body fat, decreased bone mass, memory issues, so brain fog, but also actual memory issues, lack of motivation or depression, because testosterone really helps drive that. Elevated A1C. So this can be your elevated glucose or blood sugar over that 90-day period. Anemia, which is really important because you don't think about men having anemia. So if you see a man with a lot of these symptoms and they have anemia, one of the first things I think of is their testosterone low. And then you can have changes, of course, with sexual function, things like the volume of your semen, or you can have erectile dysfunction issues. So that's important. And that's what men tend to think about. Yeah, there are a lot of great people that you can find. Yeah, thanks for mentioning those. Thanks for being so active in the chat. So lots of good resources in Tuscaloosa and in the West Alabama area for sure. So weight loss over 40, the reason it's so hard is because our bodies are changing again. And we talk about our bodies changing as teenagers, but we don't often talk about it when we're in our 30s and 40s. And so our digestion can change, our metabolism can change. Decreased growth rate of our cells in our body. So when we do have an issue, an injury, something happens, our cells don't always recuperate as fast as we have had in the past. That cell rate slows down, and so that's why aging is taking place, because we are really our cellular and metabolic age. Lifestyle changes, maybe you're in the sandwich generation where you're caregiving for aging parents or aging family members or neighbors, and you also are parenting in your 40s. That's tend to be when you have more responsibility and leadership roles, officially or unofficially, at work. And so there is this compound effect of so much on your plate. And then that results in weight loss resistance. Yeah, I'm so glad, Jody, that that was helpful to you. I think that we have to really make sure that we're representing as many people as we can with these presentations, because we do really talk about women a lot in midlife. But one thing I'll say, kind of on that same note, is that a lot of times, my husband's neurologist, for example, said, and again, he's older than I am, so he went through this season of life ahead of me. But his neurologist at UAB told us when he was having some challenges, that it was unique that that was caught so early in his 40s, probably because I had a healthcare background and knew my husband so well, that a lot of times age-related changes or changes in your neuro, health and your mental health and things like that, testosterone, hormonal changes, often get characterized for men as a midlife crisis, when really it's that there's a physical health issue, and it's like the stereotypical midlife crisis that men have in these like pop culture movies and jokes and memes. And women's health issues, while not always about hormones, get a lot of times labeled as being a menopausal issue, when really there's other things going on. So I hope that resonates with someone. Dig a little deeper if your, family member, your spouse, your partner, your colleague, your friend is acting a little different and they're going through some of these changes. It may not just be one thing. There may be a lot more going on behind the scenes, and they may need someone to point that out to them in a kind and loving way, to ask those kind, open-ended questions and say, "Hey, have you thought about this?" Or, "Hey, is this something that's going on with you?" There's some weight loss recommendations for people over the age of 40. I've listed this here. Again, this is just a framework. It's a resource for you, not the end all be all. So it looks at the pounds you weigh versus how many calories you need versus your activity level, and helping you determine a target. But a lot of people undereat. And so people who are trying to lose weight often undereat, and they undereat macronutrients like fiber and protein. And so there's a lot of information coming out about the importance of eating protein. usually 25 to 30 grams of protein within an hour of waking up in the morning. And that's especially important for women because our hormonal cycles are very different. Men are typically, and people who have more testosterone on board, they're typically on a daily cycle, a daily hormonal cycle. Women are on a monthly hormonal cycle. And so we don't often think about that when we're giving recommendations for health and wellness, but it's so important. So this is just a guideline. Most people are going to need to eat more calories than we've been traditionally recommended in the past. And it's more about the macronutrients like fat, healthy fat, fiber, complex carbohydrates that are not going to break down into simple sugars, and having good protein sources on board. Of course, that's going to vary because if you have chronic kidney disease or diabetes, then you're going to have to be more mindful of protein and fat. But you get the idea. This is just a place for you to jump off of. Wellness basics. So we have a whole class on this, but it's sleeping well. It's not just about the number of hours you get, but about the quality of sleep that you get. Staying hydrated, drinking about half your body weight in ounces a day, but make sure it's filtered. Make sure you're using some good electrolytes. Striving for a healthy plate, meaning that you're eating half of your plate in vegetables, having a healthy fat, a good protein source, and some complex carbohydrates. Eating the rainbow, so not just brown and beige and green food, but all of the colors of the rainbow to make sure you're getting good minerals and antioxidants. Moving your body every day, so making sure that you're active throughout the day, not just 1 hour of exercise. And then meditation or mental health, taking breaks throughout the day, doing a meditation practice, walking, listening to music. Those are all things that are good brain breaks for yourself. Some other things about overcoming weight management, if this is something that is helpful to you, I've just listed this here. And there's some other things specific to weight that I think is helpful because I get a lot of questions about how do I manage my weight well. And then fitness after 40. The best time of day to exercise or to work out is when you can realistically do it. People will tell you to do it first thing in the morning because it's like eating the frog. It's like making your bed. You have an automatic win. But for some people who have immune issues, autoimmune issues, people who have a lot of inflammation, morning may not be best because that's when your cortisol levels are so high and you may be making that worse, particularly if you're doing a lot of cardio in the morning. That may not be something that you can tolerate. And so for me, I can't. I can now more so than I have in the past, but initially I couldn't do that. So I would have to do an early afternoon, early evening workout. Because working out in the morning when my cortisol levels were high were leading to a lot of inflammation symptoms, and this wasn't best for me. And so listen to your body, and don't have an all or nothing attitude about exercise or anything to do with health and wellness, because everything that you do consistently is going to add up. And so consistent is not every day. Consistent is 3 to 5 times a week. That's being consistent. So keep that in mind. Consistent is not 7 days a week. Consistent is not perfection. Consistent is more times than not, more days than most. So other reasons to get up and walk. Walking is the best exercise for most people if you are able to walk. Swimming is another great one. So swimming and walking are two wonderful exercises. And then, of course, adding in strength training in the form of weightlifting is really helpful. We have a ton of resources here on campus, but make sure that you're stretching, make sure that you're moving all of your muscles. Add in chair exercises, yoga exercises. Do some stretching at your desk. There are lots of things that you can do using no other equipment, or using no other resources than just what you have on hand. You can also download an app called Fit On, and it has a ton of different categories where you can pick if you have 5 minutes and no, access to exercise equipment, and it'll give you a workout. So other tips for staying fit, and then I've got some resources to share with you. 40 after 40, I love to give you more resources than I can ever cover because I want you to treat this like a buffet. I want you to take what resonates with you, what works for you, try it. And if it doesn't work, move on to something else. And so these are some great ones that you can start with, some 40 healthy habits. And we've got some fans of Fit On. I'm so glad, Sherry. Thanks for saying that. Miranda actually introduced it to me, and I love it too. It's great. And the free version gives you a ton of resources. So I'm going to just quickly move through these. If y'all have questions, please start putting them in the chat. But this is about the caregiving sandwich generation of where you feel like you're taking care of two different generations while you also are responsible for a lot in your day-to-day life. So the sandwich generation, put the pickles on the side. Hopefully that speaks to you and is helpful to you if you find yourself in this generation. I am approaching this because my parents are in their 70s. I still have school-age children. I have more responsibility than ever at work, which is great because I love my work. I love my life. And my parents are aging and have health concerns. And so I find myself approaching the sandwich generation. So I'm right there with you in the trenches. Pain management, so important to know your limits. Don't lift, push, or pull more than you can. Stretching and things like yoga, using the new Hinge app that you can get through UA is amazing. Miranda also told me about that one. I'm doing it, and you get tons of free stuff. You can sign up, go to wellness.ua.edu, and you can learn all about Hinge. It says that if you do exercises like in the Hinge app or yoga or Fit On 3 times a week, that people who have chronic pain are more likely, 58% are more likely to not experience pain after doing that. So, inflammation and gut health, we've talked a lot about that. Nutrition is key, nutrition and sleep. Eye health, some things that you can do there, some things that you can do for sun exposure. I popped this in the chat because melanoma is on the rise. So knowing how to look at your moles and see, do your moles look like each other? If you have one that doesn't look like the rest of your moles, that may be one that you want to ask your healthcare provider about. Is it symmetrical? Does it have an even border? Is the color uniform? Is the diameter less than a pencil eraser? So pencil eraser, it should be smaller than that typically. And has it changed or has it become elevated? Those are some things that you can note about your moles and you can catch them early. My husband has a lot of health issues, y'all. And so I use him as an example a lot because we always are talking about there's pain and there's purpose, right? There's purpose in the pain. And so he recently was diagnosed again with melanoma, and we were able to catch it really, really early, thankfully, this time, because I noticed when I was doing his skin assessment on his back that he had a spot and a mole had changed. So we were able to catch it in stage 1, and he's going to be able to have a procedure and avoid radiation, which we were not able to do when he was diagnosed with melanoma before. And it was involved in his cervical lymph nodes. And so I live this every day, and I hope that this inspires you to start taking ownership of your health. This is the information about shingles. At some point in your life, 1 in 3 people are going to get shingles. And so there are, vaccinations that you can take. There are screenings that you can do. If you get a kind of a bright red rash around your upper abdominal area on your back, near where, if you're a female, near where a bra would hit, that is likely going to be shingles. It usually clusters right at the front and back at the upper rib cage. And so that is going to be kind of telltale. So definitely know that even if you've had chicken pox, that virus is the same virus that causes shingles later in life, and stress can activate it. And so stress can activate it when you're, young, like someone just said, 27, but you also can have it activate later in life in your 30s, 40s, 50s, and beyond. And so, yes, shingles vaccination is recommended. And that's what the rash looks like. And that's the characteristic placement as well. I know we're coming to our time, but I'm going to stay on. Feel free to go if you need to, but if you've got questions, feel free to put those in the chat as well. Happy to answer them. And y'all can always come back and view this later. Not seeing any questions, but mental health is so important. And these are the things that you want to pay attention to. If you're just not feeling you're like yourself, if you're overwhelmed, sad, angry, having a difficult time coping, or you've had a major life event, you may want to reach out. We have a lot of great EAP resources here in the community and through UA. And so keep in mind that mental health is health. So please, let's end the stigma around getting mental health resources and help. Habit change is so important, but just take it slow, one thing at a time. Pick one thing from this talk today and go put it on your calendar and make a plan for it. So slow progress is still progress. Just take it one bite at a time. Okay. It's like, how do you eat an elephant? One bite at a time. Some other recommended webinars that we've done, I've mentioned a few others throughout the talk, and we would love for you to follow us. And then here's some great information for you. Hopefully, we've answered a lot of your questions that you had. Feel free to put some feedback or questions in the chat. And thank y'all for being here if you've got to go. Yes, Crystal, you don't have to worry about him getting it again or not, but you can still get shingles again. You can get chickenpox and shingles multiple times, even if you've had the disease before, the infection before, even if you've had the vaccination for both, you can still get it again. Unfortunately, it's one of those that you don't get full immunity to sometimes. Yeah, Melissa said she had it over the break and it was not fun. Yeah, and you can get shingles other places. It's just characteristic around the torso area. Hopefully this was helpful to y'all.
I will email everyone the slides. So I guess the attachment button, I'm learning on Teams, but the attachment button goes away after we get started. So I will email those to y'all today.
Yeah. And Rebecca, I would say if high blood pressure runs in your family and you want to get started on your own, you want to see your blood pressure be less than 120 and less than 80 now. It used to be that you could be in the 120s and 80s and that was okay, but now we like to see it less than 120, less than 80. Go to a kiosk over at the Student Center by Starbucks and check it. Or at the grocery store, and then you can order a monitor for $30 to $40 on Amazon, and that's a really great way to start monitoring it at home if you want to do that every day. All right, let's see what else we have.
Thank you for sharing that, Lois.
Yeah. All right.
Do
we have any other questions? Okay, I don't think so. Thank you so much, Miranda, and thanks everybody for being here. I hope you'll have a great rest of your day and hope you stay warm and dry in this weather. So, talk to you guys later. Bye-bye.